Hello and welcome to our educational video on paraproteinemic nephropathies, a group of kidney diseases caused by abnormal proteins produced by plasma cells. These proteins, known as paraproteins or monoclonal proteins, can wreak havoc on the delicate structures of the kidneys, leading to a range of serious complications. In this video, we'll delve into the causes, mechanisms, symptoms, diagnosis, and management of these fascinating and often challenging conditions. So, what exactly causes paraproteinemic nephropathies? The root cause lies in the abnormal proliferation of plasma cells in the bone marrow. These plasma cells, which normally produce antibodies to fight infection, start producing a single, identical antibody in large quantities, the paraprotein. Conditions like monoclonal gammopathy of undetermined significance, MGUS, multiple myeloma, Waldenstrom macroglobulinemia, and other plasma cell dyscrasias are the primary drivers behind this abnormal protein production. These paraproteins, often immunoglobulin light chains or whole immunoglobulins, end up circulating in the bloodstream and ultimately damaging the kidneys. The pathophysiology of paraproteinemic nephropathies is complex and varies depending on the type of paraprotein involved and the specific kidney structure affected. Essentially, these paraproteins can damage the kidneys in several ways. They can directly deposit in the glomeruli, the filtering units of the kidney, causing glomerular damage and impaired filtration. They can also deposit in the tubules, the structures that reabsorb essential substances and secrete waste, leading to tubular dysfunction. In some cases, the paraproteins can even form crystals that block the tubules. Furthermore, these proteins can trigger inflammatory responses within the kidneys, further contributing to tissue damage and scarring. The specific mechanism determines the pattern of kidney injury and the clinical presentation. Paraproteinemic nephropathies are relatively uncommon, but their prevalence is increasing as the population ages and diagnostic methods improve. Monoclonal gammopathy of undetermined significance, or MGUS, the most common precursor condition, affects about 3% of people over the age of 50. While not all individuals with MGUS develop kidney disease, it increases the risk. Multiple myeloma, another major cause, accounts for a significant proportion of cases. The exact epidemiology is difficult to pinpoint because many cases are likely underdiagnosed or misdiagnosed, especially in the early stages. The signs and symptoms of paraproteinemic nephropathies can be subtle and often overlap with those of other kidney diseases. Patients may experience proteinuria, which is protein in the urine, leading to foamy urine. Edema or swelling in the legs, ankles, or around the eyes can occur due to fluid retention. Fatigue, nausea, and loss of appetite are common non-specific symptoms. As kidney function deteriorates, patients may develop more severe symptoms such as shortness of breath, high blood pressure, anemia, and eventually kidney failure. Importantly, some individuals may have no noticeable symptoms in the early stages, making early detection challenging. Diagnosing paraproteinemic nephropathies requires a combination of clinical evaluation, laboratory testing, and sometimes a kidney biopsy. Initial blood tests can reveal elevated levels of serum creatinine and blood urea nitrogen, indicating impaired kidney function. A urine test can detect the presence of proteinuria, including the characteristic Bence-Jones proteins, which are free light chains. Serum protein electrophoresis and immunofacial for identifying and characterizing the specific paraprotein involved. A bone marrow biopsy may be performed to assess the extent of plasma cell involvement. Finally, a kidney biopsy is often essential to confirm the diagnosis, determine the specific type of kidney damage, and guide treatment decisions. Paraproteinemic nephropathies encompass a range of specific kidney diseases, each with its unique characteristics. Some of the more common types include amyloidosis, where paraproteins misfold and deposit as amyloid fibrils in the kidneys; light chain deposition disease, characterized by the deposition of immunoglobulin light chains in various kidney structures; cast nephropathy, where light chains precipitate in the tubules, forming obstructing casts; glomerulonephritis, with monoclonal immunoglobulin deposits, where monoclonal immunoglobulins deposit in the glomeruli, triggering inflammation; and cryoglobulinemic glomerulonephritis, associated with cryoglobulins that precipitate in the cold and damage the kidneys. Accurate classification is critical for tailored treatment strategies. The treatment and management of paraproteinemic nephropathies is multifaceted and depends on the underlying plasma cell disorder and the severity of kidney damage. The primary goal is to reduce the production of the paraprotein by treating the underlying plasma cell dyscrasia. Chemotherapy, immunomodulatory drugs, and stem cell transplantation are often used to control the plasma cell proliferation. Supportive care includes managing blood pressure, controlling edema, treating anemia, and providing nutritional support. In cases of advanced kidney failure, dialysis or kidney transplantation may be necessary. Emerging therapies, such as targeted therapies and monoclonal antibodies, are showing promise in treating specific types of paraproteinemic nephropathies. Currently, there are no specific preventative measures for paraproteinemic nephropathies, as the underlying plasma cell disorders are often not preventable. However, early detection and management of MGUS and other plasma cell dyscrasias may help prevent or delay the development of kidney disease. Regular monitoring of kidney function in individuals with known plasma cell disorders is essential. Lifestyle modifications such as maintaining a healthy weight, controlling blood pressure, and avoiding nephrotoxic medications can also help protect kidney health. The prognosis for patients with paraproteinemic nephropathies varies widely depending on the specific type of disease, the severity of kidney damage, and the response to treatment. Early diagnosis and prompt treatment can significantly improve outcomes. Recent research has focused on developing more effective therapies that target the underlying plasma cell disorder and reduce the production of the damaging paraproteins. Novel therapeutic approaches, such as proteasome inhibitors and monoclonal antibodies, are showing promise in improving kidney function and prolonging survival. Continued research is crucial to better understand these complex diseases and develop more effective treatment strategies. Thanks for watching.